Thank you so much. So again, thank you so much for having me. I'm really excited to speak with you all and to engage in conversation afterwards on ways that we can support Black youth, um, particularly as Black youth have experienced sort of two major pandemics, which we're going to talk about throughout this presentation. And so I'm hoping that this sort of drives discussion and we can come up with culturally strength-based ways and have a healthy discussion about ways we can support Black youth from a strength-based lens. And so the title of this sort of keynote, what I'm going to talk about is Roadmap to Resilience, the critical role of strength-based assets in the lives of Black youth. And so within this presentation, I am going to talk a lot about this dual pandemic that I refer to as, and others as well, as COVID-19 and racism. And so really highlighting the challenges that Black youth had to contend with during this time and still are contending with. The importance of using a strength-based and an empowerment lens. I'm going to provide definitions for that because I think it's very important that we sort of start off with we all have this sort of same knowledge in terms of the definitions and the terms that we're using. The importance of using culturally responsive models as practitioners and clinicians and stakeholders that are vested in positive youth development. I think it's really important that you all do this work every single day, but it's also important to take notice of models that are out there that sort of guides the work that we do to ensure that we are centering the voices of Black youth in ways that is beneficial to them. And I'm going to discuss the important role of stakeholders and why culturally relevant after-school programming and community partnerships matter for Black youth. And so first, let's talk about this dual pandemic, COVID-19 and Black Americans. And so we know that, and this is through some of the findings, some of the statistics that we see, that COVID-19 has disproportionately harmed communities of color, specifically Black folks. And when we look at what's happened to Black American families during that time, Black Americans had some of the higher and have past and present, some of the higher COVID-19 related unemployment rates to date. And also other studies have revealed that because of these unemployment rates that were sort of related to COVID-19 outcomes, Black households are facing wage disruption. And so this is sort of exacerbating already existing disparities that might have harmed Black youth. And when I'm talking about already existing disparities, we're talking about educational disparities in terms of what we see in our achievement gap, access to resources, representation in terms of honors and AP classes. And then I'm talking about health outcomes, the way in which Black Americans' experiences have been within our healthcare system. And so these sort of instances of COVID-19 related unemployment and the wage disruption exacerbated already existing disparities. And so in addition to that, when we talk about the specific role of racism and how that sort of also traumatized youth in terms of this dual pandemic, Black youth report up to 5 racial discrimination incidences daily. And this decreases well-being over time. And by well-being, I'm meaning the way that youth perceive themselves, their identity, their sense of identity and who they are. And it also impacts their academic achievement. And also as a result of that, you have COVID-19, which sort of deepened Black and American inequality. And so COVID-19 did indeed enhance racism. And also, because Black Americans had to contend with white supremacy, experiencing racial violence, they were also more likely to die from both COVID-19 and systemic racism. And so as a result of this, COVID-19, Black youth had a reduced engagement in terms of extracurricular activities. They were less likely to have in-person meetings with their family and friends at this time. And as you all know anything about the developmental stage of adolescence, we know that peers are extremely important. There was a challenge in the transition from in-person to online learning. However, what Black youth were exposed to through media through vicarious experiences was racism. And so they saw sort of this increased sort of visibility of racism related trauma at the same time. And so here it is, on one hand, you have their major social support systems being shut down in terms of transitioning to online schooling. They're not really involved in extracurricular activities, and we know how positive that is for youth, but also this reduction in sort of seeing their peers, and also having to have Black American families sort of contend with the sort of historical systemic inequalities in terms of how our healthcare system and racism has sort of impacted Black families. And so now they're being exposed to race-related trauma at the same time. And so I also want to sort of go further in terms of racism and sort of how we're defining it. And so previously, when I talked about Black youth experiencing up to 5 racial discrimination experiences per day, there's also, so that piece of it is sort of the interpersonal, right? So the daily experiences of racism, so they're interpersonal experiences. And so this example is, being followed when they go in the store, being racially profiled in their community, being ignored if they raise their hand within a classroom. And so what's interesting about this is that cultural racism was also something that Black American families had to contend with as well. And so what is cultural racism? It is really rooted in such language, imagery, and symbols that disparage groups. And so we saw it in the Trump, when he was, when Trump was president, and how social media and Trump were referring to COVID-19 as the Chinese virus and Kung flu. That is an example of cultural racism. And then even sort of extending that to how Black and Latinx folks were blamed for structural and systemic inequality. We had at the time Surgeon General Jerome Adams recommending that Black and Latinx people sort of step up and avoid alcohol, tobacco, and narcotics during the pandemic on April 10th of 2020. So what's interesting about this is that one of these sort of is rooted in language, imagery, and symbols, and the other is sort of rooted in sort of existing stereotypes and biases about Black and Latinx communities. And so when we talk about this one form of racism, sort of these daily experiences of racism that was reported up to 5, Black American families had to also contend with cultural racism as well. And so then we get to structural racism. And so this occurs when our society, our institutions discriminate, disadvantage, neglect, or oppress based on one's race or ethnicity, according to David Williams. And so how do we see structural racism show up? Well, it shows up in racist housing, excuse me, in our criminal justice system, in our education system, and also in our healthcare system. And what we saw how structural racism sort of operated, it denied COVID-19 protection to poor and minority families, neighborhoods, Black and Latinx communities, like hospitals at the time, diagnostics, and quarantine housing. And it was also cases where Black Americans were being turned around from the hospital when they sort of exhibited symptoms of COVID-19, but yet they weren't able to sort of receive the healthcare that they were, that people deserve. And so we sort of see how structural racism operates as well too. So again, I just want to point out to the audience that we're not only talking about these sort of interpersonal experiences of racism, but we're talking about cultural racism, structural racism, and how these things intersect within the COVID-19 pandemic. And so how are we beginning to center youth with all of this? And so we have this sort of detrimental impact on Black youth, the potential of this detrimental impact on Black youth. And we see here why it's important to center Black youth. Well, we know that adolescence is characterized for stressful transitions and hard decisions. And so we know that adolescence is a stage of development where youth are trying to figure out who they are, what they want to be. They're sort of grappling with different social identities. They're, participating in extracurricular activities. They're also trying to figure out what high school to go to. And then after that, for some, whether it be in trade or high school or sort of getting a job afterwards. These are the things that Black youth are dealing with at this time in the midst of COVID-19 and having to contend with multiple forms of racism. And so COVID-19 and the Black Lives Matter movement caused many youth problems in terms of the way that Black youth were wanting to be a part of the Black Lives Matter movement, part of the Black Lives Matter movement endorsing that, but also having to contend with COVID-19. So through racism, their schooling experiences, trying to negotiate relationships, and also sort of shaping their identity as well. And so again, COVID-19 affected youth, ways that I talked about in terms of shifting from in-person to online learning. That was very stressful for school districts across the US. Why? There were some school districts that did not have the capability to service their students. There were issues of not being in, not having Wi-Fi connection. The districts not being able to ensure that for some communities. Some students were in rural communities as well, but we know that there's a lack of resources and access to resources there. And so this shift was very stressful in high schools and colleges for youth throughout the US. And so for Black families, in addition sort of to this shifting, the death of George Floyd really did confirm their own memories of racial inequality, while for many other parents, they were in despair and they were enraged and they wanted to know sort of what to do, but yet they had to sort of deal with this COVID-19 pandemic, their child at home, online learning, and sort of just how to have effective communications around race and racism, right, at this particular time. And so it's in this time of fear, rage, isolation, bewilderment, and sorrow that finding effective ways to assist Black children, youth, and families is crucial to well-being and also identity formation. And again, you all, identity formation is, who am I? Who do I want to be? What is important for me? And this is a critical stage of adolescent development, more so for children of color who have to sort of negotiate and sort of grapple with these sort of multiple social identities that they have. And so COVID-19 and racism matters. We know that Black communities have been ravaged by COVID-19. Black families also face racial violence, COVID-19 and racism, and that systemic racism also exacerbated COVID-19 stresses. So what do I mean by that? Historical vestiges of slavery and Jim Crow laws, the racial, economic, social, political histories of how Black families have sort of experienced a healthcare system or an educational system exacerbated COVID-19 stressors. And so social support matters. And so one of the things that we found during this time was that for Black youth, having a connection to peers and to family mattered and was crucial during the pandemic. And this is what one author found. And it was also reported that for some Black youth, there was a struggle in sort of finding sort of social support mechanisms in some ways that some youth did not have that sort of social support in their lives, whether it was family, peers, their church, their community, their youth serving community organizations. And so some developed an avoided coping strategy, right? In terms of closing themselves off. However, this was associated with anxiety, depression, and stress. And so for Black youth, reporting higher levels of social support mattered and did indeed improve mental health during COVID-19. And so still sort of having that connection mattered and was particularly important. And so also, in addition to social support systems in terms of family and peers, because Black youth were contending with not only COVID-19, right, that adjustment, they also were dealing with racism as well, right? And so we also found that Black youth activism mattered in some ways, that this elevated youth voice at this time. This was not something that was adult-led. Studies have shown that at this time, because youth were contending, Black youth were contending with COVID-19 and racism, this led to Black youth activism. And so Hope is one of the scholars that examines Black youth's racial stressors and critical consciousness. And so racial stress, in her study, she found indicated that this critical agency to want to dismantle and address inequities, and this action to end racism and discrimination was particularly important for Black youth. And this was through joining a protest or a march. And you saw this during the COVID-19 pandemic, where American racial violence sort of provoked societal unrest. And so George Floyd's death sparked these nationwide protests. And at this time, even though we were sort of contending with COVID-19, Black youth wanted to become involved. And so Granton Smith has a theory sort of around this and believes that COVID-19 and structural racism, the intersection of both, promotes activism. So this social identity, this relative deprivation, this efficacy that persons have, this serves as a model for change, for social change. And it really does promote collaboration against systemic inequalities among disadvantaged groups. So what he's saying is that there is this phenomenon among disadvantaged groups that share a similar status. We know how COVID-19 impacted Black families. We know how racism has historically impacted Black families. And so because of this, the sort of unrest around this is going to lead to activism. And this is something that we were beginning to see in Black youth during this time. And so according to this paradigm, groups that feel discriminated against, racism, protest. Social action will ensue if a group suffers more. So not only, again, that Black Americans had to contend with the COVID-19, but they also had to deal with racism, contend with racism as well, too, sort of in this racially charged climate. And so it is vital to investigate racism and COVID-19 because Black Americans are more likely to experience racism, particularly Black youth, in terms of reporting experiencing 5 racial discrimination experiences per day. And I keep saying that because that's a lot. You know, when we talk about becoming resilient and we're talking about what Black youth sort of have to contend with, plus the cultural racism, plus the structural racism, and plus sort of seeing this sort of family dynamic shift and change as a result of COVID-19 and being disproportionately affected by the pandemic. And so all of these things, which is also important, so in addition to social support mechanisms, parents, family, peers, that we've seen, socio-political development is also sort of being nurtured at this time too for Black youth. And so this entails children understanding how systemic variables and structures, so these beliefs rooted in our institutions, promote inequitable outcomes. And so Black activism fights inequity. And according to Deemer and his colleagues, inequality attitudes influence Black youth's expected voting, their civic engagement, their traditional political action, and their social action. So here it is, you saw sort of these, these, again, dual pandemics, and what sort of arose of it, what came from it was this idea of activism, sort of social political development that was important, and also specific social support mechanisms that were important for Black youth at that time. And so again, the killings and social media exposure of Black Americans in the US, and most recently Tyree Nichols, does damage Black youth's wellness in terms of who they are and who they want to be. And so again, I mentioned racial socialization because it's this it is these messages that are communicated to Black youth during this time around racial barriers, around racial pride, around how society might view you. So it is a preparation. It is what we refer to as the talk. So these things are happening also at the same time. And so it's not just, I have my parents here, I have my peers here, but it's this emotional sort of connection, this conversation that's also happening that helps Black youth. Not having that and being exposed through social media damages Black youth's wellness. And I also, in another study, Jones revealed that during the COVID-19 pandemic, Black youth were only impacted, but over 25% of Black parents worried about their child's health and their racism at the same time. So again, this dual pandemic was something very unique to the lived experiences of Black children, youth, and families within the US. And so this leads to a study that I was engaged in during that time. And I was very fortunate enough to be invited into a school district at that time because they were very much interested in wanting to understand how to service the youth. And I remember my first meeting with the school district, they wanted to know how are the children doing at this time, because they knew the transition was a lot. This was in a predominantly Black community. And as you all know, Washington University is actually in St. Louis in Missouri. And so a lot of parents also looked at the stress of George Floyd, but was also triggered by the death of Mike Brown in 2014 here. And so this sort of conversation came to the forefront because, again, the district wanted to know how are the children doing. And so the title of this particular study I did is What's Going On? Racism, COVID-19, and Centering the Voices of Black Youth. And so this study data sort of examined Black youth's experiences in school during the pandemic and racial unrest in America, and was collected within the Midwest, in the state of Missouri during the 2020-2021 academic school year. And so I was very much interested in the online and vicarious exposure to racism, because again, youth were online, but yet they had had this sort of increased rate of sort of browsing, whether it's the TikTok, the Instagram, the Snapchat, Twitter. And so I was interested in examining the online and vicarious racism, COVID-19 stressors, and their perceived virtual peer and adult support, their own perceptions of activism, and how they were coping with COVID-19. And I measured that through COVID-19 adaptability among Black youth. Again, we wanted to center the voices of Black youth, and I wanted to honor that school district's request to do that as well. And so before I get to that, those findings, it's also important to note that at that time, in terms of the 2020 and 2021 academic school year, the dual pandemic had been studied very little. And one of the scholars called the COVID-19 epidemic a racial macro stressor for Black American households. And I thought that was very powerful because the racial macro stressors are unforeseen events that disturb daily life. And so racism, the death of George Floyd, and COVID stress on Black youth adaptation and activism were sort of centered, because I sort of drew on that definition of this racial macro stressor in sort of doing this work. And so at this time, I was given access to a high school. It had a large number of students. However, there was also conversations about student fatigue. And this was a community that was under-resourced, that where 100% of the students qualified for free or reduced lunch. Adolescents range between the ages of 12 and 18. The mean age was 15. 63% of the sample identified as female. And so this was a cross-sectional analysis between middle and high school students, and a total of 123 Black girls. Black students had complete data. That's 77 and 46. So it's not Black girls, but it's Black students. Excuse me for the typo. And so the average age was 15 again, and participants were given a $10 incentive. And again, just noting the small number, these are children who wanted to participate in another sort of virtual sort of survey. And so I'm grateful to those students who wanted to share their experiences about what was going on. And so just to give you all this visual representation of this, I was interested in how the protective role of virtual support, right? Again, youth transition from in-person to online learning. Extracurricular activities did not exist in the school district because of COVID-19, and it already was under-resourced. And so I wanted to understand sort of this intersection remembering racial micro stressors and how it was defined. And so how did racism impact COVID-19 adaptability? Basically, how were youth coping? How did racism impact activism? And also, how did COVID-19 stress impact COVID-19 adaptability and activism? And also, what was the role of, even though they weren't in person, what was it like having peer support through your sort of online schooling, and also adult support, whether it was from the teacher, the assistant teacher, the staff, the administration, one's mentor, adult mentor within that environment. And so I wanted to know the virtual supports that were available. And this is also something that the district wanted to know as well. And one of the things that I also talk about this road to resilience is that, as I'll talk about later, we only can get there if we have authentic collaborations with our community partners. And so again, I mentioned that with the school district because this is a relationship that I honored and that I value and that I listened to as a researcher, and sort of going in this space to sort of understand and help them sort of understand their students as well. And so also, because of the dual pandemic, I was also interested in how COVID-19 stress sort of exacerbated racism and how it impacted Black youth adaptability and their participation in activism. So at this time, 2020, 2021, students are trying to find out who they are, who they want to be. And again, Black youth contending with both COVID-19 and racism at the time. And so what were some of the findings? So some of the findings from this is that increased social support from adults was associated with Black youth adaptation in positive ways. And so having a supportive adult led to Black youth feeling is that they can sort of brainstorm around possible strategies to assist them in the COVID-19 pandemic. And that not having support from adults led to risky higher levels of high-risk activism. And so what's high-risk activism, you're asking? And so the high-risk activism is where youth are at risk of going to jail, where there is a destruction of property, whether there is a lot of anger around in terms of protesting, where they knew that this might have been happening, but they put themselves out there anyway. And so not having social support from adults, lower social support, sort of predicted higher risk activism. But interestingly enough, having the support of their peers mattered. And this led to sort of higher engagement in high risk activism. And so, which was pretty interesting around to me, but made sense because, you know, peers influence, you know, adolescents are most influenced by their peers. And also, if you don't have adult support there, and Black youth are sort of having to contend with their peers around how to deal with COVID-19 stress, how to address racism, online, vicarious racism, contending with other types of racism as well too, they are going out there sort of engaging and being part of and putting themselves in places where they may risk going to jail. And furthermore, Black youth who reported higher levels of racism and adult support had higher levels of COVID-19 adaptation. And let me explain that a little bit. And so in the presence of exposure to high levels of racism, social support from adults buffered that, so reduced the negative impact on racism, on COVID-19 adaptability. So in this way, Black youth who've had someone to speak to, that was protective for them. And so that sort of mitigated and reduced the harmful impact of COVID-19 and on how they adapted at that particular time. And also, it's also important to note that this sort of dual pandemic, that Black youth with high levels of COVID-19 stress and racism engage in high-risk activism. And so what does this mean? Black youth who reported higher levels in terms of being stressed out by COVID. And some of these items were, my parents have lost their job. We are worried about how we're going to sort of survive. Another family member is sick. in addition to experiencing and being exposed to higher levels of racism, being exposed to, I'm sorry for the noise in the background, wait for it to go by, okay, being exposed to higher levels of racism, they engage in high-risk activism. And so these findings really underscore the importance of social support in youth lives, but also the importance of peers and the harmful effects of this dual pandemic, COVID-19 stress, being stressed by COVID-19, worrying about your family, worrying about employment with your parents, worrying about if your parents are losing their job, worrying about if someone is going to get sick, and also having to deal with racism impact Black youth's well-being. And so overall, this study provided information on assisting Black youth and how to cope with anti-Black racism and COVID-19, the important role of adults and peers, the impact of racism and COVID-19 stress impacted Black youth well-being and activism, and then serving Black youth with a strength-based lens rather than a cultural deficit approach is crucial. And as I go on later, I'm going to talk about what a cultural deficit approach is. But why this is a strength-based approach is that I'm going to sort of document it for you all. Why this particular study was a strength-based approach was the fact of honoring the voices of the district, honoring the voices of the youth, picking measures in a model that was culturally responsive, that spoke to the needs of what was happening with the population at that time, and being able to contribute to the research literature, and me being able to share with you all what worked and what was supportive mechanism for Black youth at that time. You cannot do this work. You cannot be strength-based centered if you are not centering the voices of the community and also sort of centering the voices of Black youth in that particular context. And so doing both, I think, is really, really crucial. And so overall, in order to adequately understand what Black youth face in terms of racism and COVID-19, Black youth voice must remain central to understanding what is going on and finding strategies to support them. And I am going to talk about those strategies right now. And so what does look like this road to resilience, right? What does the road to resilience look like? And so first of all, there's a lot of do's and don'ts that I have. So the first thing I want to say about resilience is that resilience in relation to Black children, youth, and families is that Black families are not a monolith. Black youth are not a monolith. And so this means that there is a road and a path to resiliency. Because one method or strategy works with one Black youth or with a family does not mean it will work with the others. And so I just want us to be very, very clear about that, it is a collaborative process in terms of us meeting you where they're at. And so the first thing I'll say is stop the gap gazing. That's part of the road to resilience. Moving ahead, simply reporting on COVID-19 rates in Black families is insufficient. You have to have a deliberate focus on services that help Black youth thrive, which is very necessary. And so I say this gap gazing because sometimes we can become so enamored with the numbers, whether the numbers say, which are important, that Black families are at risk for A, B, C, and D. We know that Black families have been impacted by COVID-19 at devastating rates. We know that Black youth have been exposed to race-related stressors in ways that other youth have not been exposed. However, what can we do to center their voices and to use a culturally strength-based lens to assist on this road to resiliency? And also, resiliency also encompasses for us in doing the work, what are we bringing to the table as well too? Because we don't want to put the onus all on families and youth to sort of do this work. And so to put it another way, there must be an awareness, a recognition, and a comprehension of how racism and COVID-19 worsen existing disparities in education and health. And so stop the gap gazing means don't just stay at the numbers. and do your programming based on that. But understand the historical legacy of racism in the US. How has it impacted Black families in education, our healthcare system? And one of the most glaring disparities that we see inequities is in our criminal justice system. Understand how historical legacy is the foundation for some of the existing disparities and those numbers that we see. That was sort of stop the gap gazing and have us sort of lead to a solution model if we understand this legacy. Also asking who's included and who's not. That means, how are multiple social identities being accounted for? Are we speaking about Black LGBTQ plus youth? How are Black trans lives being factored into the COVID-19 and then this sort of racism as well as sort of the dual pandemic, because we then have to add in homophobia, transphobia as well too. So who's included and who's not in this conversation? And the road to resilience means that it has to be collaborative. Again, people are not superheroes. Resiliency for one person is not resiliency for another person. So it's a road. We do this together in sort of getting where we need to be at. And so stop the gap gazing, understand historical legacy of racism in the US, ask the question who's included and who's not. And the important thing is to collaborate. And also, we have to get rid of the cultural deficit theory. This is a perspective that has permeated practice, our research, our science since the 19th century. So the cultural deficit model is a perspective that minority group members are different because their culture is deficient in important ways from the dominant majority group. So in relation to COVID-19 and racism, the cultural deficit perspective can look like endorsing beliefs that culture is the reason for the disparities and the inequities. So it's not honoring the historical vestiges of slavery and Jim Crow laws. It's not acknowledging the systemic inequalities. It is a victim blaming sort of definition of why, an explanation of why Black youth, why existing disparities sort of permeate. It's rooted in racist ideology, and it happens a lot with Black, Latinx, and Indigenous communities. And it promotes victim blaming. And so I have examples here of statements that I've heard people make. Police brutality. If only that person would have just did what the officer asked, it would not have happened. Gap gazing. Well, the numbers say they are more likely to be at risk, so they are at risk. In terms of academic achievement, well, Eric is underperforming because he comes from a single mother household. All of these goes back to cultural racism that I talked a little bit about earlier in terms of how we view and how we see groups. And we saw this with the dual pandemic in terms of COVID-19 and racism and how Black children and youth and families were being viewed. This was even sort of highlighted in the statement that the former Surgeon General made, Jerome Adams, around not telling Black and Latinx families not to engage in alcohol and other substance use during this time as well. So it's very much rooted in a cultural deficit perspective. And so where does this come from? The Moynihan Report was a report in 1965 that attempted to explain the state of Black America at that time. And in this report blamed and shamed poor Black single mothers by sort of stating that they were the reason for the Black children's lower academic achievement, poor health outcomes, and divorce rates. It is 2023, and this explanation is still viewed by scholars, by some practitioners, and by some of our educators within school settings. This is a cultural deficit perspective. And it also worked its way into the dual pandemic as well. It is also rooted in white supremacist ideology and research in terms of performance outcomes, using race to explain one's performance outcome, using skull size or skin tone to explain antisocial behavior, looking at one's brain size, and creating racial hierarchies of superiority. And this whole idea of the myth of race, we know that race is a social construction. However, it has meaning within the US, and it has real implications for the lives of people of color. And so when I say stay away from cultural deficit perspectives, I am going to talk about strategies and questions that you could ask yourself in hopes that you would not sort of go down this path. But we see and hear this a lot when it's conversations about Black children, youth, and families, and trying to explain existing educational and health disparities. And so we want to go to a strength-based lens. So the strength-based model promotes strengths within a community. Starting off, why? Why do these existing disparities exist? Why has COVID-19 devastated the Black community in comparison to other communities as well? Why is there racial unrest, and why did that happen to George Floyd? The question of why are Black youth reacting this way? Why are Black families enraged? It's questioning why, because then you will get the answer that you are seeking. You might get the answer that you are not seeking, but you've asked the question why. It has to be asset driven. Even though this community has experienced this particular trauma, what's working within this community? Earlier, I talked about the important role of adult support, parents, peers. I also talked about it's important for youth to get engaged, to feel like that they can become civically engaged. This idea of social political development, asset driven, talk to youth. I've talked about support systems. It can also be community organizations, mentors, kinship support. Cultural and racial, using a racial and cultural lens. What does that mean? Sort of centering the voices in the community of who you serve. You're not going to use a one-size-fits-all model that's used to sort of explain the well-being of family, because that might not account for the history of slavery and Jim Crow laws for Black families. You have to be intentional about the racial and cultural lens that you're using. It has to be intersectional as well, centering the lived experiences of who comes in your door. And empowerment. What can we learn from the community, but how about also what work have we done on ourselves as well to get to that? All of that leads to a strength-based lens. And this is why, going back, I encourage you all, take off the cape. Take off the cape. We want to engage in strength-based strategies, and we want to sort of promote strength-based assets when we work with Black children, youth, and families. And so how do we dismantle this cultural deficit lens? Well, being in a position of power and believing in a cultural deficit lens leads to endorsing anti-Black racism. And so if we are leading organizations, leading institutions, leading educational spaces, leading healthcare systems, leading criminal justice systems, where one is in a position of power and you see existing disparities, and we know existing disparities are there, this is a cultural deficit lens that is happening. This institution endorses anti-Black racism. They're using a one-size-fits-all model, even though they have the best intention, trying to honor and serve those that come through their door, but not understanding or missing that racial, not understanding and not having that racial and cultural lens. And also, authors have discovered that endorsing beliefs that racism was not important for counseling and clinical psychology students was associated with fewer integrated forms of racial identification. And so it's within this graduate program where they sort of interview white counseling and clinical psych students and found that those who did not endorse beliefs that racism was important. You know, they thought it was not important. That led to fewer integrated forms of racial integration for them. And so they were less likely to want to have conversations within the classroom, within their client, sort of within that particular space. They did not think it mattered. It matters. In a way, we have to do this, and to destroy this cultural deficit lens and to destroy white primacy, we have to be intentional about including color conscious policies and practices, and they must be established in order to remove whiteness and colorblind mindsets. So colorblind mindset, I don't see color. When people come through my organization or my school or my lab or within my classroom, I do not see color. I treat everybody the same. Well, you are going to be promoting a cultural deficit perspective because it's a one-size-fits-all model. In order for us to be able to serve who we want to serve and to assist Black youth, right, on this road to resilience, we must be aware of the role of white supremacy. We must be aware of the historical legacy of racism and Jim Crow laws in the US in order to service the communities. And we must have a racially and culturally strength-based lens. And so also we have to center Black youth. Practitioners should embrace intersectionality to better understand how multiple social identities interact within oppressive and privileged power structures of Black youth. So you determine who will be included and who will be excluded if you do this work. Right? If you're doing an intervention, if you are engaged or want to use a curriculum, look at the manual. Who was it normed on? It's almost like when we think about clinical trials, we want to make sure that we get nice representation because we need to see how, you know, these medicines work, right? It's almost the same way with interventions. They have information on who it was normed on. That means who was it tested on? Sometimes our interventions are normed on white middle-class families. And so if you have an intervention, despite it being 5-star, who will be included if you use it and who will be excluded? This goes to centering Black youth. Thus, it is critical to understand how people of color have traditionally been marginalized, stigmatized, and regarded through these prisms of these cultural inadequacies. And again, this is just being cognizant of the tools that we use. And so when working with Black youth, it is critical to recognize the impact of COVID-19 and racism and the impact it has on Black communities. So again, it's also important, as I stated earlier, that Black families and Black children and Black youth are not a monolith. What works for one Black person or Black adolescent might not work for the other. So this is why collaboration and centering their voices to understand their strengths and assets, that question why, is particularly important. So you want to recognize the variation in Black youth resiliency. And on the other hand, you want to be cognizant of this as well too. You want to make sure that it's embedded within your practice, your engagement with others, and with adolescents as well too, because it is very vital. And so this is a kind of the theoretical model that I was talking about, this conceptual model. So this is research-based. However, as practitioners, as researchers, as stakeholders who service youth, these sort of articles around how do we service Black youth, even if you work with Latinx populations, AAPI community populations, Indigenous populations, there are scholars that have created tools for you all to use that's out there. And so this particular model was developed by myself and a scholar at Vanderbilt University. We wanted to understand how Black families navigate stress in America, but we wanted to be able to use a socio-historical lens. We wanted to own that at the very onset. And so we developed this model. And from this model, it took about 2 years for us to work through this because we had to gather all the research literature and really find out what works and what doesn't work for Black families. And one of the things in this model I want you to pay attention to is we automatically start off with the importance of history. We also understand and honor the contextual stressors that Black families might have to contend with, their social positioning, what it means to be a Black male versus a Black female, what it means to be a Black LGBT adolescent person. This is also important as well. And then the type of stressors that you may have to go through. But what's particularly interesting, I want to bring your attention to, because this is a huge model, I want to bring your attention to what we term culturally strength-based coping assets. And this is something that's rooted in the research literature. And I want to just kind of explain why this is important. And so the road to resilience also means that we have to be culturally responsive, okay, on our road to resilience and to help Black youth. And so when we talk about here, this ordinary magic, we refer to these internal and external sort of assets that Black youth have, and Black children, youth, and families have. So one of them is cultural legacies. And so this is a history of storytelling. This is a history of storytelling through talking, leading, having conversations about the resiliency of Black people in America, the history about one's family, how they've made it, how they persevere. This sort of oral storytelling in the research literature has been something that's been very important for Black families. Family values is particularly important. Family cultural values, family cohesion, right? How families remain together during hard times, how they're working together. Beliefs and goals in terms of how they feel around well-being, health, education, all of these sort of positive promotive processes, racial socialization, having the talk. These conversations have been happening since the 19th century. There's research that documents this in terms of how Black children are to prepare themselves in America. These things are beneficial. Having a healthy racial identity, so being proud to be an African American. Racial socialization messages leads to Black youth. And again, adolescence is a time of finding out who you are and who do you want to be. You're grappling with these multiple social identities. And so racial identity, it is important that you have a healthy racial identity. Kinship support is particularly important. In Black families, it's a collectivistic perspective. It is not only those members within the household matter, but it's also persons that we also deem important within our communities, within our worship community, within the school community as well. Again, you all going back and highlighting that significant finding, virtual adult support mattering for Black youth. Also, religion and spirituality. According to the Pew Research Foundation, African Americans are one of the most religious groups within the US. Also, the Black church has been one of the most significant institutions in the history in terms of how it's helped and assisted and continues to help Black families, providing tutoring services, providing mental health resources, paying for tuition for children. And some of our historical Black colleges and universities started from churches. And so again, these are things that's rooted within the research literature. Having so that this optimism and positivity to persevere and this future orientation, how do you see yourself despite the trauma that you might be engaged in? And so I say this to say, these culturally strength-based coping assets is something to use and consider when working with Black youth, but also giving them the opportunity to also name what's important to them as well. And so I also want to note that even though I have culturally strength-based assets up here, it's not until I sat and spoke with youth and found out that activism and being involved and wanting to address inequalities was particularly important to them as well. So we have some updating to do with this model as well. And so again, the use of culturally strength-based assets promotes empowerment, a culturally relevant perspective, and awareness of Black youth. Black youth programs should promote culturally relevant after-school activities and school community connections, whether it's with healthcare agencies. And it's also important that research center Black youth voices and better comprehend these two pandemic effects and the long-term outcomes on Black youth well-being. Two things I want to say with this. To be culturally relevant also means that you have to center youth voice intentionally. So create space for Black youth. Also, the long-term outcomes, because 2020, 2021, we're sort of out of the pandemic, it doesn't mean that Black children are not going to be impacted. What are the long-term outcomes of this dual pandemic on Black youth? How is that going, or how has that contributed to their already existing disparities? How can we make sure that this road to resilience is a collaborative process in terms of understanding who they want to be and where they're going? This will help you support, because we're not finished yet. We've not seen the sort of distal outcomes in how this dual pandemic has impacted this population in particular. So collaborate, working with Black families. And so to focus on youth voice and understand how practitioners deal with Black youth, we must understand how Black families have been traditionally seen. History and narrative is important. Community-based participatory research with a strength-based and culturally empowerment perspective is needed to attain this goal. And it also is important to assist practitioners to understand Black youth's life experiences and cultural dynamics to be effective. So let's go back to community-based participatory research. That's another term I want to define. This is where we bringing in community, the folks that we want to serve, to the table and coming up with a solution together, coming up with a program together on how best to service youth. It also includes having youth voice at the table, Black families, Black leaders, Black communities, staff within your organization that services them. This is a holistic, collaborative approach. And again, going back to that slide where you see this huge model, collectivist socialization. That means, how are we collectively working towards a solution to empower Black adolescents? And so I want to underscore that as well. We could talk a little bit more about that. And we also need to intentionally create space. And so in one study, Parker interviewed 12 Black adolescents. And during this interview, and I want to go through this particular study because she intentionally centered Black youth and created this space. And so she interviewed 12 Black youth and sort of highlighted, and Black youth sort of highlighted their struggles adjusting to COVID-19. They talked about having little connections with their peers. They absolutely hated online learning. And there were some mental health issues due to COVID-19, but also worried about race issues in the US. And in some ways, some of these youth sort of have race-based trauma as well. And so, however, what this author found was that in order to sort of help them cope through that, Black youth depended on their family, their school, their religious community, and other sort of cultural specific techniques such as religiosity and spiritual coping, whether it was through meditation. And so this study emphasizes the importance of Black youth's lived experiences and how this might shape culturally responsive school mental health interventions in response to COVID-19 and racism. And so again, it's only through centering youth voice that we began to understand the effective ways to help them. And now this is where I'm gonna challenge you all. We need to do the work. That requires for some of us to do some reflection, constant reflection. So let me say this. Cultural humility is a journey. I don't say cultural competence because sometimes we think when we take one cultural competence course that we're set for the rest of our lives. We are not. I call it a cultural humility journey. And so what does that look like? Let me go back one because I want to stop it. I don't want to go through all the questions. And so we have to start on our journey before we lead someone on a road to resilience. We must be honest about where we're at in terms of how we've come to interact and to work with families of color, particularly Black families. So researching the self. So one of the questions, in what ways do my racial and cultural backgrounds influence how I experience the world? This is something I want you to ask yourself. How does this emphasize what I do in my practice and how I evaluate and interpret others and their experiences? And the biggest question is, how do you know? How do you know your racial and cultural background is not influencing your interaction with Black youth? How do you know? What do you believe about race and culture in society and practice? And how do you attend to your own conviction and beliefs about race and culture in your practice? Why? How do you know? What racialized and cultural experiences have shaped my decisions, whether it's research, decisions, your practices, and the approaches that you use? What intervention you use, what curriculum you use, how you choose to engage or empower or work with families? How have your own racialized and cultural experiences shaped that? And again, the road to resiliency and to be empowered, in order for us to empower others, we have to ourselves be empowered. It's almost like, that, when we get on an airplane, they say, secure your own oxygen mask before you help others. This is what this sort of cultural humility journey is, okay? Also, the biggest question, do I endorse a color and culture blind ideology? Do I endorse beliefs about that? Epistemologies, am I unknowingly using them? And practices when I engage with Black youth? Am I doing more harm? How am I considering history? Is this a culturally strength-based lens? Am I presenting an opportunity to create space for Black youth so that they can tell me their own experiences? How am I working with others to be solution focused? How am I not endorsing cultural deficit perspectives? And most importantly, how can I take this cape off? Is my cape off? And so these things are really important on a cultural humility journey when we try to talk about this road to resiliency in terms of helping each other. And so this helps assist in understanding that Black youth are entrenched in many contextual settings, whether it's family, school, community, where they're grappling with different forms of racism and the impact of COVID-19. And many of these things have a direct impact on Black youth well-being. Empowering Black youth in schools, neighborhoods, and youth serving organizations will benefit them if you're on a path of cultural humility. And practitioners must see Black youth in an ecological setting, no matter at what level it's at, and be committed to collectively, there's that word collective again, to collectively understand how social, cultural, and situational issues affect Black youth development, and how to take a preventative strategy to help Black youth. Okay, very important. And so what else can we do in terms of centering Black youth? Develop Black youth advisory groups. And so you could have, a safe space where you're trying to get youth's opinion about a particular program that you want to implement, or just understanding where youth are at. But developing Black youth advisory groups sort of rebuilds community trust by involving kids, their families, educators, researchers, and leaders as education experts and equal partners. And as Black youth advisory group, you are doing this for Black children, rebuilding community trust, and they are the experts of their own lives, as they should be. Practitioners and other related professions, other stakeholders should learn about historical trauma in Black families. We have to prepare, train, and mentor culturally relevant educators who are called to the profession and who are supported by their families. And you can also be supportive to families as well, too. Right now, I have concern about this because right now throughout the US, we have in certain states where the history of particularly African-American history is being challenged. Some school districts are removing anything related to diversity, equity, and inclusion. And so I am worried about the learning that is happening with our practitioners at the collegiate level, but also what our children are exposed to because if we don't understand history, we will not be prepared in terms of to handle the current day stressors that we have. And we would not be able to lead people down a road to resiliency. And also we have to have open dialogue and understanding how practitioners may knowingly or unknowingly use white epistemologies and ideologies to work with Black youth. That is through our measures, the tools, the surveys, the 5-star intervention that's evidence-based, but never included a Black child or Black child in it. And also our curriculums that tend to be whitewashed, but because we don't see color, we are still going to implement this with this adolescent. And so we have to be able to engage in an open dialogue about this as well. And so what is the current state of COVID-19 and racism? And so I wanted to just highlight this report in terms of the current state and where we're at. And so COVID-19 and systemic racism, we noted, has disproportionately impacted and traumatized Black children, youth, and families. We need to be cognizant of that post-pandemic mental health and racial trauma and how it would continue or how it has impacted education. And that schools constantly being attacked will not really be able to address Black children's social, emotional, and academic requirements if they are not centered in the curriculum. And right now we sort of see this happening. And then police violence and the Capitol insurrection reactions have further sort of impacted Black communities' faith in schools and our governmental institutions. And so everything that's going on is a result of structural racism and is continuing to happen. So again, when we talk about exacerbating existing disparities, now Black families have to contend with being erased in K-12 systems in some states. And so this is very, very problematic. And this should be alarming for all of us right now on this Zoom. And so this is where the current state is at. And so how do we ensure that we are dismantling this as well, especially if there's another pandemic that sort of arises? We want to ensure students have equal access. We want to make sure their basic necessities are met. We want to be sure that we are addressing stress and trauma using a culturally strength-based lens. We want to be able to authentically connect with students, families, and communities. We want to develop culturally sensitive and tailored curriculums and assessments. We want to support student and families' health and well-being. And then we want to provide professional development and teacher training. And I always say that it's intersectional and that has a historical lens about the population that you indeed are trying to serve. And so it's also important, though, that we identify additional supports and resources. And so some of the things that stakeholders are doing is that we know that we're in an age of social media. And so we can also inform teens, and work with teenagers through organizations, through social media. So Facebook, Twitter, YouTube, WhatsApp, Messenger, Instagram, TikTok. You all probably know others. I'm trying to name all of them that I know, but there's there's a high usage of these sort of social media outlets by teens. And so this is one way that we can find additional support systems for them. We could provide community stakeholders, partners, and leaders with information on telehealth services for Black youth because of the exposure of online and vicarious racism and other sorts of stressors. Stakeholders can use culturally informed approaches to working with Black youth to understand the impact of racial trauma during COVID-19. We've talked about this, and all of this work should be performed through a culturally humility lens and really understanding the realities faced by communities of color. And you also need to do a constant reflection. Any program that you do, who's included and who's not? Who's being excluded and who's not? How does the population I'm working with, how are they reflected in this? How has this been successful with other programs that have tried to service Black communities? And so it's a constant reflection, constant sort of questioning, which will lead to us being very successful in identifying these additional supports and these additional resources. And so moving forward, this road to resilience, do the work. Self-reflection is very important. We want to make sure that we understand how important our interactions are with Black youth, considering context. So whether it's through our one-on-one interactions, through our community organizations, school setting, healthcare, employment, how are we interacting with youth is particularly important, and using the strength-based lens. And this is a part where I want to sort of kind of go further into. And so it's not just centering Black youth, but it's also the programming that partners with Black youth in your space. You want to make sure that your staff is reflective of the population that you're serving. You want to be sure that you're using culturally responsive assessments, tools, and strategies. And this can be simply done by calling the distributor of that particular assessment tool and just asking them who has it been normed on. And you want to make sure that you want to get to culturally relevant after-school programming and school community partnerships that are healthy for Black youth. Again, Black youth must see themselves within your organization, and they must feel as if they have a voice. This is the road to resilience. And I say the road to resilience because they will get there, and it is a collaborative process as well. And so also, I know I've said this many times, please stop gap gazing. Ask the question, who's included and who's not, and why? And most importantly, understand that Black families are diverse. Again, they are not a monolith. Consider the intersectional experience of Black families. You want to help youth identify additional support systems. You want to listen, you want to do active listening, and you want to be supportive in this process as well. And so thank you all so much. I am at the end of the presentation, but I look forward to a healthy conversation around additional ways to support Black youth. And I'm really looking forward to the questions that you all have. Thank you so much.
Wow, thank you, Dr. Butler-Barnes. So much there, such rich content and so much to unpack. I really appreciate it. Yeah, thanks. Got a few questions coming into our audience. Please remember that feel free to drop questions into the Q&A. You know, just a few things that really stand out for me. I just love that notion you stated early on about that the intersection of stressors actually can lead to agency. You know, we often say here at the trauma center that it's safety, predictability, and control that really help people get through the tough times, and that the notion that that actually can help people to gain control. Yeah. Love that. I was also reflecting too, one of the things I really appreciate about your talk is that, you know, I had a professor in grad school once who used to say, we can teach you all this stuff, probably the most important thing is to ask, so what? And you gave us a lot of the so what. So thank you for that, the what to do with youth. And I'm sure that that can translate absolutely, I would imagine, to people who work with adults as well.
Absolutely.
Yeah. Let me call out a couple of questions or thoughts that are here. One was, could you speak more to the ways to amplify and uplift the ordinary magic you spoke about, the strengths of Black youth and families, without unintentionally objectifying or oversimplifying? This person said, what a resonant concept.
Yeah, and so the thing about it is, anytime, and so I understand that, I do understand that question. And so when you center the voices of, and so a couple of things with that ordinary magic. And so that ordinary magic, how we got to that was a systemic review of articles published over in the past 20 or 30 years around Black families. And these are a collection of it goes into like this sort of algorithm in terms of what has the research shown that's been a protective mechanism for Black families. And so those are just some of the culturally strength-based coping assets that we have seen consistently that is important for Black families. And so when we talk about protective mechanisms, however, to get at this idea of tokenizing or objectifying Black families, this is why it's important that you bring people to the table. You center the voices, you ask them, what is it that you would like to see? If I would never have done that, if my colleagues would never have done that, we would never have known that Black youth are angry, Black youth want to be involved in activism, and that social political development is also sort of being nurtured as well too during this time in ways in which our generations didn't really have to contend with. And so it is this idea of, if we do not want to objectify people or tokenize, because that's the cultural deficit perspective, right? We want to be able to bring them to the table and say, and you don't even have to have the ordinary strength-based assets, but some of those things are going to come up. And you ask them, how is it that we can sort of solve this together? What is it that you see? What do you rely on? It's the why, and the what. And that is the way that you will not lead to objectification. But again, it's this being intentional about including youth voice.
Really include their voices. Yeah, great.
Yeah.
Thank you.
Great question.
Here's a question about, and then this certainly resonates, I'm sure, with many of us. How can clinicians and educators deal with burnout in their own responses to traumatic events in the news, like just the recent news about Tyree Nichols, for example? It's because what's impacting our kids,
yes,
impacting many of us too. So thoughts about that?
Wonderful question. And so it's an interesting question because I have another project here, and I'll get to the question, but it's right on to that what that participant asked. I gave a talk yesterday on this large study that I was doing, and it's on how parents talk to their children about racial violence. Mm-hmm. And yesterday was Tyree Nichols' funeral. Mm-hmm. That was one of the most difficult presentations that I've ever given in my lifetime as a scholar, because I knew the work was important, but I also know the importance of self-care. And so I say to you all, create spaces in your organizations that are safe for you to be able to take some time away from this work. Because even with myself, I had to take some time, and you have to engage in self-care or it will lead to burnout. Organizations, if you are supervisors, if you are part of an organization, if you are a CEO, these things are particularly traumatizing, especially for people of color to see through the media, and as well as for others as well too. I think intentionally creating spaces, giving time off, being generous with mental health days, mindfulness work, I think is particularly important, but also supports for teachers is particularly important. Supports for organizations is particularly important, which all gets back to resources and the objective and mission of the community organization that you're with. But one of the things that I can say in doing this work is that you have to take care of yourself, because it is a lot. It's a lot. And I don't know if I have an answer about how your organization or their organization should distribute resources, and how it's distributed, but I do think it's something that is important to bring up, especially if you have people of color. And I see someone in the chat, I made sure not to watch the video. I cannot watch the video. I have not watched the video, and I will not watch the video because it is particularly traumatizing for me, and it's a lot. Yeah, and it's a lot, but you have to create this safe space for yourself. And I hope that the organizations you're in allow you all to do that work too. And it's okay to take some time. Yeah. That's okay too, but we got to take care of ourselves.
Absolutely. Great point. We've been hearing that from a lot of people in the last couple of days. People just saying they just could not watch this once again, and traumatize themselves in doing so. It's enough to hear about it and
that's right.
Imagine the horror. We don't have to see it. Yeah.
That's right.
One of our colleagues here at Riverside writes, you spoke a lot about including the historical legacy of racism in our thinking about how we mitigate the cultural deficit lens. How do you reconcile this thought with the current political atmosphere, where there appears to be a disagreement about whether the historical legacy of racism should even be discussed in universities or pretty much anywhere in our communities?
Yeah, I mean, it's disheartening, because Black history is not just, or Indigenous history is thus not Black people, or Indigenous is not only important for us, but it's everybody's history. And I think when you're not having and engaging in these conversations, we are not preparing our children for the type of America that we want it to be. I mean, the research shows that in terms of when we're talking about curriculum, a racially and ethically diverse classroom, and a curriculum that is respectful to those who are in the classroom, meaning that is very diverse, culturally responsive, that's the best learning environment for children. There's science on this. I think the reason why I think that we're politicizing it is very harmful. I think it has harmful effects on the students in those spaces now. And I'm just hoping that we get through this, but it's detrimental. And I think that if we don't have these conversations, we will continue to have a revisionist history about what did and did not happen. But in order for us to be the America that we want to be the society that we want to be, it's imperative that we talk about what happened in America, the good, bad, and the ugly. And people do not want to talk about that, but it doesn't mean it did not happen. It has real life consequences when we look at disparities right now. You know, if we look at the disparities and sort of use the philosophy of not talking about it, you will absolutely endorse a cultural deficit perspective, because you would think that people are born wanting to be grouped into these disparities. Nobody asks us to be loaded up with stereotypes and biases when they're born. Nobody asks to be unknowingly put in a statistic of a school to prison pipeline. But this is where we're at right now. And so we have to encourage each other to remain strong and do what we can to make sure that that conversation happens, because it's important for us, and it's important for America, I think.
Yeah.
So I hope I answered that question.
Well, perhaps we need that. There should come maybe some more activism to your words
Activism,
earlier around
exactly.
this kind of
At
issue.
all levels, right? At all levels.
Back.
Yeah, absolutely. And I'm glad to see the youth doing what they need to do. For example, in Florida, what's happening now, and it's happening right here in the state of Missouri as well too. One district just eliminated anything around DEI for teachers, for students, anything around diversity, equity, and inclusion. So it is happening.
Yeah. Thanks for that.
Yeah.
You know, one of our folks asked, how does if you could comment on how Asian disparity in racism compared to Black disparity in racism since the onset of COVID-19. Is that something you could comment on?
Absolutely. And so let me also note that this is why the historical legacy of racism in the United States is also important, because then we learn about the Japanese internment camps and internment camps in a way that Asian Americans were sort of perceived already as being viewed as foreign and loaded up with all of these sort of negative stereotypes, and the fact that AAPI communities have to contend with the model minority myth. That has exacerbated since the COVID-19 pandemic. And if you all don't know what I mean by the model minority myth, is particularly detrimental for Asian communities, because it's this idea that they came to America, they pulled themselves up by the bootstraps, and they are the ideal group. They are all great in STEM, and that's particularly damaging because that's leading to a lot of psychosomatic complaints. And so this group, I want to note, has always sort of had to contend with anti-Asian hate and racism. So I want to say that because that's why history is important. And in terms of COVID, I think that's had a detrimental impact on Asian communities. And it's still so to this day. There was a racialized incident that happened in Indiana. I don't know if you all heard a couple of weeks ago, where an Asian student, a college student, was just sitting on the bus, and then someone attacked them because they felt like they were responsible for COVID-19. And so these things are happening in the same way. And I wouldn't do a comparison because they're both important. And it's important that we understand the history of both. And I think there are ways in which we can also support AAPI communities as well, too, in terms of how they're being blamed for COVID-19 and the already existing hierarchy of racist experiences that they have to go through within the US as well, too. And that's the same for Indigenous groups, and that's the same for Latinx groups and some of our immigrant communities as well. So I hope that answered your question.
Great. Thanks.
Yeah.
Another comment, and maybe this was somewhat addressed a little bit before. Youth services are underfunded on both a federal and state level.
Yes.
Services for youth of color funded even less.
Yeah.
What are your thoughts about how to advocate for youth of color on a macro level?
Yeah, and so one of the things I think we have to do is meet with our local politicians. We have in some states city councils, we have aldermans that are within pockets within these neighborhood community organizations that are advocating for the importance of positive youth development programs. That's one thing we can do. I myself attend board meetings, not necessarily they're not board meetings, that's the wrong terminology I'm using, but community meetings for our local youth serving community organizations to understand their need. I try to, we rally up and volunteer. And so if that organization is not able to have funds or to make ends meet, we as a community are there to sort of assist. I also charge my university with also helping communities that we have these MOUs with that are struggling at this time. And so that's the activism part that I think that we all can do, get involved in our local community politics, use the science to talk about why programming is particularly important. For example, we know between hours of 3 and 6, 3 and 7, that's where children, if they're not supervised, get involved in a lot of deviant sort of behavior if they're not supervised. Those are the type of statistics that our policymakers within our state sort of need to know. And so use the science, be active in your community, volunteer, and also work with that community organization as a partner. Those are things that I've been doing. And again, if you use the science, we know how organizations are important for positive youth development. And so I would say, just please stay the course, but be involved in all of these levels as well too. And I know we're taxed with everything else that we're doing, but I think it's important that we do it for the kids.
Great, thanks. You were mentioning being careful to make sure that any assessment tools, the programs that we're looking at are normed on a wide range of cultures and stuff.
Yes.
One of the questions here is, are there some specific questions that should be included in our assessment so that we're being more culturally sensitive?
Yeah, and so that's a wonderful question. And so there is, if you want to be, that's a really great question. I'm trying to figure out how to answer it from both ways. And so one way is if you want to include additional questions, what I usually do is, to this day, if I know I'm meeting with a group of teenagers, and I have a tool that, even though I think the tool is culturally appropriate or responsive, or intervention, I meet with a group of kids who I know that I'll be giving it to. So a different group of children, right? But they're very similar in terms of race, ethnicity, background, they're all in there. I usually ask them, what is it that you think about this? What if I gave this to one of your friends? What would you think? How is the wording? How is the questioning? Teenagers will tell you if it's ridiculous or not. I have a teenager. So they will let you know if it does not make sense. That's one way to do it. But for me, there are tools that I found that was not culturally responsive. And so I might have said, instead of asking, what is your experience like in this program, I would augment it and say, well, what is your experience like in this program as a Black adolescent? And because I'm letting youth identify themselves. So they tell me they're a Black LGP or Black queer youth. I'll say, okay, how's your experiences as a Black queer youth in this space? Do you think, what are the programs that we need? So it's giving them voice and adding language to a question that sort of would center them, if that makes sense.
Great. Yeah,
I hope that makes sense when I'm saying.
I find that helpful. Thank you.
Okay.
I'm going to ask you one last question, and then actually just ask the question. So maybe two. People are asking, would you be, able to share the handouts? Because we're posting handouts.
I'll share some of the slides. Yes, I usually don't, but I will for this group. Yeah,
that's very nice. We can put that, just to the audience, we can put that on the website, the landing page, or on the next day or two.
Oh, okay, great.
So,
just give me the next couple of days. Absolutely.
Check back on that, please. And similarly, one of those a couple of folks asked about was the one about your that sort of schematic you had of the historical.
Oh, I'll send that.
It's a great.
I'll send that for sure.
Awesome. Yeah. One last question, the couple of minutes we have left. How does the history of racism in medical research and delivery affect utilization of services by people of color, and how can we overcome that fear?
Ooh, that's like a
in
whole
just 2 minutes,
documentary.
please, right?
Okay. It absolutely impacts families. Well, it absolutely impacts health outcomes. And one of the things that I think it's important for this group to know is that you'll see some of the most glaring disparities and inequality in treatment in our medical, in our healthcare system. If you hold socioeconomic background constant, like if across social and economic diversity, Black people are consistently underdiagnosed and not treated. We have a huge problem. And what's happening now, schools across the US, the medical schools, are being challenged with just having that one cultural competent course. They're being challenged to learn about the history of medicine. One of the textbooks I know that some schools are using is called Medical Apartheid. And that's a book that people are beginning to use to sort of, for students in spaces in medical professions, to really understand sort of the history of Henrietta Lacks, the why Tuskegee, or why we even have IRB now. So it's these sort of isolated history of Black people and treatment in America with other groups, but also leading up to Black women dying, giving birth as well too. So it really does sort of highlight how racism has impacted these areas and how we have to do better as a medical community in addressing that as well. So that is a conversation that is happening. It's long overdue. And I'm hopeful. I'm hopeful that this can be a discussion as we sort of move further into the work and how we service not only in our community-based organizations, but in healthcare as well too.
So
that's
again,
a great question.
Calling it out and continuing to do it.
And doing the work. Yeah.
Wow, thank you. What an amazing presentation and great conversation. I wish we had another hour with you to continue.
Thank you so much for inviting me.
But so appreciate it. Thank you so much. And